The UNESCO Category 2 Institute has contributed 6 projects in the new National Action Plan for Early Childhood Care and Education. These projects are related to data management in ECC within the institute itself, development of national standards for preschool education, development of national framework for unregistered childcare services. We also have 2 systems that we want to develop, and these are incident tracking and management within the institute to ensure efficiency in the processes and procedures in the institute, and as well as for registration, inspection, and reporting in childcare services. These projects are very much in line with the Institute strategic priorities, the Institute digitalization plan, the Seychelles framework on ECC, and the UNESCO Tashkent Declaration 2022. And essentially, these projects will be funded by the government of Seychelles through the Institute's recurrent budget. So what do we want to achieve at the end of the 3-year period for the 6 projects at the Iecd? Is basically to improve efficiency in the delivery of childcare services, improve efficiency and also the delivery in preschool education in Seychelles, increase the qualifications of early childhood teachers and service providers, as well as addressing the issue of unregistered and unlicensed childcare services in the country. On this note, I wish my dedicated team of project officers every success in the implementation of their projects. And also as a Category 2, we hope to promote these initiatives as best practices to improve the quality of service provision in ECC and positively impact the holistic development of young children in early childhood in the Seychelles, in the region, and beyond.
The education sector has 3 projects under the new National Action Plan 2025 to 2027. The first one is an expansion of a previous project looking at mainstreaming social emotional learning, or SEL, across all our state schools in the early childhood phase. We have teacher training that is coming to all teachers and teacher assistants. We'll also be collecting data on the current practices happening within our classrooms when it comes to SEL and children's existing social emotional learning. We'll also be having implementation of our lesson and assessment plans across the schools. We will be doing this by phase so that we get a chance to collect data as we go and see how we can implement this across. We got very positive results from the last pilot phase, and now we're hoping to bring this to all our schools. The second and third project will work in parallel, and they both respond to the need that we've seen within our schools to provide further support for children with additional educational needs. We've had more and more children coming into schools with developmental delays and other concerns, and we've had teachers express to us that they feel ill-equipped sometimes to be able to provide for the diversity of learner needs. So the 2 projects that we're looking at, the first one is looking directly at capacity building for educators and other professionals, where we want to improve on their knowledge and skills, their competencies around providing for diversity of children's needs, but also at their confidence. So sometimes we know that we do training, but some teachers express that they still don't feel confident in order to implement the programs. So this will be looking at how do we boost their confidence as well. The third project looks at the systems and structures around implementing programs that support children with additional educational needs. That includes at classroom level, at school level, and beyond in our work with other agencies. So to look at what do we have in place, have an audit of what we already have, and look at how we can improve those systems to ultimately benefit our children.
We have 2 projects for the National Action Plan. One is to do with children walking the street until late. We want to understand why children in the Perseverance district are frequently on the street until late. Given that our mandate is to safeguard and ensure the safety of children where child protection is concerned, we feel that this project will inform us on the situation and to really establish if the children are out there for a purpose, or is it because they are lonely, meaning within the household there are things that are pushing them outside where they meet their friends. And because our issue is because with children on the street on their own, unsupervised or unaccompanied by responsible adults, this for us means that the child could be exposing him or herself to high risk of violence, of delinquency, of emotional abuse. So we as social services for the ECC project, we want to understand why are they on the street until late. The second project is one which we started working on in the previous National Action Plan. This time around we want to evaluate the interview rooms and waiting room that we put together, which is for the comfort of our clients, children especially. We want this time in the action plan to find out or evaluate how effective the rooms are, meaning to ensure that when our clients, especially children, come for our service, they feel comfortable, they can open up easily with us. But this cannot happen if they come within a condition or sitting or standing, meaning our condition previously was not as good as it is now. So we want to evaluate if this change has brought about change on their part where service delivery is concerned from our side, and where they themselves feel more comfortable, where they can say that I've got the client satisfaction when approaching social services or when coming to social services with their problems.
The local government and community affairs has decided to come up with 3 projects to feature in the National Action Plan. The 3 projects are all based on the Tashkent Declaration, whereby we will be focusing on outdoor play for children in our communities. The first 2 projects will be on Ladig and Prale Island in the daycare center, which has been constructed and renovated last year in our former projects. The Ladig one will focus mainly on creating a more conducive area in the outdoor space at the daycare center. It will comprise of building a boundary wall and sandpit that will be beneficial to the children, providing safety from the outside environment and from the pollution that is currently being observed. The projects will be funded under the District Small Projects Fund, and the Ladig District Administration will be the one that will be funding the projects. As for Beset and Prale, it will focus on the outdoor as well, outdoor environment, whereby today it's concreted and it emits a lot of heat when children play, and limits the area that the operator can use with the children based on the large group of land crabs that access the area due to its location. And also there's no shelter from the sun and the rain as well. So the operator finds it difficult to use the area, and children has reported many times that they have fallen and get minor injuries. So to rectify this, we have come up with a project where we will be piloting an outdoor area whereby it will be better for the children to use and for the facilitator of the daycare to manage the space. The third project will be in the Onsope district, in the district administration area compound, whereby we will be building a sandpit, a covered area for the children in the community to be able to get access in play. These sandpits will encourage children creativity as they will be able to manipulate different items in the environment for their own development and learning.
The Ministry of Youth, Sports and Family has 3 projects in the new National Action Plan. The first one is sensitizing parents, nurturing little minds. The project itself is a parenting project whereby parents are given sessions on how to better interact with children from age 0 to 6. We do interactive sessions with the parents, and we've selected 4 schools in which the project will be implemented during the course of the 3 years. The second project is Engaging Children, a holiday program. This is a new initiative, a new project within our sector, whereby we will be working with the parents in the Southwest region, 4 different schools, where the parents will be given an opportunity, a place for them to keep their children during the December holidays. In the project, the parents will have a safe place for the children to be, whereby the children will be able to learn, interact, have fun. At the same time, the parents' mind will be at ease. It is a very interesting project which not only caters for the needs of the children, but also caters for the parents as well. Our last project is Safeguarding Young Minds. Again, we are targeting the parents of early years, whereby the parents will be provided with session on safe technology. We want parents to be engaged in those sessions, whereby they will learn how best to use technology, but in a safe environment with their children.
With this project, we want to look at the challenges and barriers faced by the children with special needs in Seychelles. So we know that we have a number of children with disabilities with special needs. It can be from mental, intellectual or physical disabilities, and it affects their lives somehow and the lives of their families as a whole. So with this project, firstly, we want to look at the different challenges and barriers that are faced by these children and their families, be it from the educational side, the health system, or the society as a whole. Secondly, we want to look at the different gaps and challenges that exist from these different cadres, the health, educational, and the society. And finally, we want to get the perspective and opinions of the parents on how is it that we can make a change and improve these different barriers or deficiencies that exist in making their lives and the lives of their kids better as a whole. So the project, we will try to get the little clients that comes to our clinic in the outpatient department, because we find most of these children, they are followed up by pediatricians. So when they come for their visits, we will have an interview with the parents, and from there we will have the questionnaire where we can address all these different questions that we have, and from there we will get all the information that we have for this project.